Hello everyone, I am Dr. Pratyusha, Consultant Adult and Child Psychiatrist at Continental Hospitals. So today we're just gonna brief about the mental health issues that are seen in children. So let's go according to the age-wise. In mental health issues in children, they can be seen as early as 18 months of age. So these are grouped as neurodevelopmental disorders. So the neurodevelopmental disorders includes, I'm pretty sure you must have heard of these names like, autism spectrum disorders or attention deficit hyperactivity disorders, or the most commonly behavioral issues that we see in children. So the symptoms or the signs that the parents should watch out for these things are mostly if there's any developmental delay. It could be either a motor delay, like rollover or walking is slightly delayed, or there is a speech delay. The child does not maintain eye-to-eye contact, doesn't interact with the other children, not responding to the name call, or has a stereotypical behaviors as interested only in certain things, prefers to plays with household objects than toys. Some sensory issues in children that can be seen like auditory. For example, the child is too sensitive to loud noises and does not like them. Even a small sound of a mixer or a grinder in the home would kind of trigger them. Or the child is mostly spinning around themselves, or likes a certain textures or does not like a certain textures. All of these symptoms should give us a hint about autism spectrum disorder. So that is when the parents should kind of come for an evaluation. The next we see is ADHD, that is attention deficit hyperactivity disorder. As the name itself suggests, it has two components. One is the inattention component and second is the hyperactivity component. So the hyperactivity component in children can be seen as, the child is constantly running about, moving about, is extremely fidgety, does not like sitting at a place. The inattention component is, they don't focus when they're being talked to, or there might be complaints from school that the child does not pay attention in the class, or is constantly disturbing other children, or trying to get away from their place. All of these things should give us a suspicion about ADHD. So moving to slightly older children, that is maybe in the school going age, from age of 5 and above, we see conditions like anxiety and depression. Yes, it can be seen in children as small as 5 years of age. But anxiety and depression in children is usually different from adults. So it's most likely instead of low mood, we might be seeing more of irritable mood. Like you see the child is very grumpy or cranky and does not like interacting as much as before. Or the activities which the child usually used to love does not want to kind of go to play or indulge in those activities anymore, or kind of blocking themselves in the room for a longer time, or indulging more in just a TV or gadgets. All of these things should give us a suspicion that there might be something going on with the child. And again, slightly older children, if we go somewhere in adolescence, we have to be aware about the substance uses. It could be different substances like alcohol, cannabis, or anything which are easily accessible to children these days. So any change in the behavior of the child than compared to before should give us a suspicion that there might be something going on with the child. So either you can directly offer help, or that's when you have to go and seek help. So one tip for all the parents that I would like to give is, when you find that there's something going wrong with the child or there's slight change in the behaviors, one you have to do is kind of try and be more supportive with the child. Give them a non-judgmental space where the child is willing to come and share their problems with you. And when they do come and share those problems with you, don't ridicule them. Don't say that these things don't exist, or our times were kind of different, but rather give them a listening ear and show them support. That's when probably you can reach out for the psychologist or a child psychiatrist that you can take, where they would evaluate and kind of explain you or the treatment options that are available. So don't think that you're alone in this journey. It's a process where all of us are together and we're going to find peace with it.